one of the key things that philanthropists can do, and I mean, I guess what we all know is Bill Gates, is actually they signal that global health is worth investing in, that actually this is a really important area and we need to be paying attention. And so in a sense, yes, putting the money in is important, and actually, thinking about how to channel that, but actually even just lending that attention of saying, I am someone who could invest in many different things and I'm choosing health is, I think, a really positive message to all the other philanthropists across the world, and also all citizens who are thinking, what should we be thinking of investing our money in? If someone like Bill Gates does it, I can imagine people think, well, it must be a pretty good idea.
And clearly, looking at the example of Gates, I mean, Gavi wouldn't exist without Gates, given that Bill Gates and Melinda Gates kind of provided the foundational grant to Gavi, $750 million to help close the vaccine gap between kind of the ability of children in relatively wealthier countries like the United States or the UK to access vaccines, although unfortunately not all parents vaccinate their children here in the US, versus kind of what was possible in the developing world just a little less than 20 years ago. And so it's about signaling and the investment of resources, but it's really about being able to marry those two together and put things on the global health agenda. So I know we certainly hope, and I think one of the reasons we sighed kind of collectively at the beginning is we hope that kind of in this moment of uncertainty around kind of, bilateral funding flows in global health, we hope that there will be other philanthropists who step forward to kind of provide continuity of funding if need be in some of the areas where we've made some tremendous progress, or even in new areas like non-communicable diseases, which now claim a greater share of the mortality and morbidity across the world than infectious diseases do.